Melchert. I'm from the Department of Molecular Pharmacology, and this is a recorded class about the novel coronavirus and the disease it causes, COVID-19, for the course Pathology and Immunology of the first year of pharmacy. Today's date is March 18th, 2020, and I would like to talk a little bit more about the disease features of an infection with SARS-CoV-2, also known as coronavirus disease 2019 or COVID-19. So it's been compared a lot with the flu and the common cold, and there are many similarities. Of course, we have coronaviruses already circulating in the population that caused the common cold, so it doesn't come as a surprise. So the common cold and the flu actually are not very similar, because a common cold usually has a gradual onset of symptoms with no fever and lots of sneezing and mucus production, a runny nose, sore throat, while flu usually has an abrupt onset of symptoms with fever, fatigue, headache, and not all the mucus production. Well, the coronavirus is very similar to the flu, except that it causes severe disease in more people than flu does, as we can judge now. And the most common symptoms of the coronavirus are fever and dry cough with sometimes headaches, but no runny nose or sneezing. This is an overview of the most common signs and symptoms of COVID-19. It has a incubation period of 2 to 14 days, and on average it takes 5 days to develop the disease. And for people who develop severe disease, usually that is around 5 to 7 days after the first symptoms. So, as said, fever and fatigue are very common symptoms that are caused by the cytokines that are released by the immune system. Some people develop diarrhea, which can be explained by the fact that cells in the intestine also express the ACE2 protein, which allows the virus to enter those cells. What is very specific for people with severe disease is a decrease in the number of white blood cells, and more specific lymphopenia, which means a specific loss of lymphocytes. Why that is, we don't know. And of course, the respiratory symptoms are best known. So what is very specific is a shortness of breath, which develops in severe cases into a viral pneumonia with acute respiratory syndrome. And sometimes people also develop multi-organ failure with kidney failure. So we'll go through these conditions later on. So who develops what? Around 80% of the people just develop mild to moderate disease that doesn't require any hospitalization or treatment, and they will completely recover. About 20% of the people develop severe disease and 5% critical disease. And the total, the case fatality rate is around 2%, although it's still not completely clear because we're in the middle of a pandemic. But it's not that only the people with severe or critical disease die. It can also happen that people first have mild disease and suddenly deteriorate and then die. So when you talk about infections of the airways, usually when the upper airways are infected, that's a transient infection that doesn't lead to severe disease. And when the lower airways are involved, then you get severe disease with death. And this also seems to be the case for coronavirus. This was the structure of the lung. These were the larger airways, the smaller airways, and the alveoli. So coronavirus can infect cells here, so the ciliated cells, the goblet cells. It can infect cells here, again ciliated cells, but also club cells. And it can infect cells here, so the type 1 epithelial cells, the very flat ones, and the type 2 epithelial cells. So if it infects cells here, you usually don't have very severe disease. But when the virus starts infecting these cells, then you run into problems. Why is that? That is because these alveoli are the respiratory units. That's where the gas exchange takes place. So they have very thin walls, and that's because gases need to transfer from the air compartment to the blood compartment. So in order to travel to the blood compartment, you would want a very thin wall. So that's why these type 1 epithelial cells are very flat. So if you damage these type 1 epithelial cells, because the cells are infected and the virus will lead to the destruction of the cells, it means that this wall is also damaged, and you run a chance of bleeding out into your lungs. So whenever these cells get infected, the immune system immediately starts reacting to prevent you from bleeding out in your lungs. So that means that there will be sort of a clotting process that will lead to hyaline membranes, this red thing here, which will plug leaks from the blood vessels. The destroyed type 1 cells will be replaced by proliferating type 2 cells. So the type 2 cells were sort of a stem cell for type 1 cells. So if there are no more type 1 cells, the type 2 cells that are here will start to divide and make sure that the whole thing is covered. And then eventually it will turn into type 1 cells again. And there are lots of immune cells that will help with fighting the infection. That means that there is lots of inflammation going on here with edema, and this all results in a very thick wall between the air and the blood. That means that it's very difficult to exchange gases, and that's why people develop shortness of breath whenever the alveoli are involved. So normally the disease, the immune system will fight the virus, and then the disease will resolve, meaning that you'll go back to a nice healthy alveolus here with thin type 1 cells. But in some rare cases, this doesn't resolve and develops into fibrosis. So that means that there are fibroblasts coming in that will start make scar tissue. So this wall will stay very thick, and you will have ongoing damage to your lungs and ongoing shortness of breath after such a viral infection. This is another way of depicting it. Here's the normal healthy alveolus with a very thin wall of type 1 cells. Here's the blood, the interstitial space, which is very thin. And when there's destruction of the type 1 cells by a virus, then here's the hyaline membrane that will develop to prevent bleeding out. And there's lots of immune cells coming in that produce lots of mediators and factors that will help fighting the virus. There's lots of fluids coming into the lung, all making it more difficult to breathe. So what does this look like under the microscope? So this is a normal lung. This is an alveolus. Here's another one. And you can see that they're very thin walls. And in between the two arrows is a very thin alveolar wall. And when these cells get infected, you will get diffuse alveolar damage, also known as DAD. And you see that these alveolar walls are a lot thicker all of a sudden. This pink stuff is the hyaline membrane to prevent you from bleeding out, and this is the alveolar wall that is thickened with lots of immune cells, which immediately makes it clear that it's very difficult to exchange oxygen. This is also apparent on an X-ray. So normally when you make an X-ray, tissues and bones are white because of the matter reflecting the light, and if there's air, then the picture becomes blacker. So this is a normal lung, it's quite black, you can see the ribs. But when there's lots of inflammation going on, there's lots of fluids and edema that will reflect the light, and you'll see all these opacities showing that there's very little air spaces in these lungs. So another consequence of this infection is that the immune system will try its best to fight the disease. So there's lots of immune cells coming into the lungs, into the alveoli to fight the virus, and they start producing lots of cytokines and chemokines to attract more help, which means in some extreme cases that this can lead to a cytokine storm, meaning that there are so many immune cells that make so many cytokines that the cytokines will spill into the blood and will start affecting other parts of the body. And that can then lead to multi-organ failure and death. So here we have the lungs producing a cytokine storm, which can induce clotting in the blood vessels, which can lead to shock. Of course, there's lots of lung injury because there's inflammation going on with cell death. And all these cytokines can lead to immune paralysis of circulating immune cells and other organs to fail, most notably the kidneys. So this, if you don't die of actual lack of oxygen, this is another big cause of death in patients with respiratory distress syndrome, is a cytokine storm. But if the virus doesn't kill you, it's also possible that you will develop a bacterial pneumonia, because your lungs are so busy with fighting the infection, the viral infection. As you can see here, here's the viral titer. Your immune system is busy fighting that, so lots of immune cells die because they are fighting the infection. That means that bacteria in your lung can then start growing out because the immune system is busy with something else. So your lungs have a microbiome, just like the gut has, and these bacteria can start to grow out when the balance in the lungs is disturbed, and can lead to an overwhelming infection that then might kill you. That's why people with a viral pneumonia will also be treated with antibiotics to prevent this co-infection with bacteria. So what are the risk factors for this severe disease? Well, first of all, there's old age, obesity, high blood pressure, smoking, and comorbidities. And incidentally, all these conditions are associated with increased expression of ACE2, the protein that was necessary for the entry of the virus into cells. So old age, we know from studies that the expression of ACE2 increases while aging. People with obesity also have higher expression, just like people with high blood pressure. Smoking has been shown to increase the expression. And comorbidities. Comorbidities means other diseases, so people with other diseases also have a higher chance of severe disease. And some of these comorbidities are also associated with higher expression of ACE2. So let's talk about mortality by age a little bit. So this is the case fatality rate of the disease, and this is age. And as you can see, when you're young, there's very little risk of dying from COVID-19, but the case fatality rate starts to creep up after 40 and becomes really high, around 15%, when you're 80 or above. That doesn't necessarily mean that only old people will die, and I put these two pictures up to illustrate this. This was from an article in the New York Times. These were or are two Chinese doctors that were treating people with COVID-19. They were both 29 years old. They both had one child, and they both got COVID-19, and they both became very ill. They had to be treated in the intensive care, and only one of them died. And I'm not going to tell you which one. I think you should look it up on the internet. But one of them died, and one of them managed to fight the infection and was fine afterwards. But this shows you that it's not just old people who can develop severe disease. So who usually develops severe disease? It's people with other diseases, comorbidities. And of course, older people usually also have other diseases. So whether the association with old age is because of the comorbidities or the old age is not clear yet. But especially people with cardiovascular disease, diabetes, COPD, and hypertension, and cancer have a higher chance of developing severe COVID-19. For cancer, it's probably because they're being treated with harsh treatments to fight the cancer. Hypertension, cardiovascular disease, and diabetes are associated with higher expression of ACE2, and COPD is a disease which is usually caused by smoking, which might explain, and smoking is associated with higher expression of ACE2, so that might explain why they're at risk of more severe disease. But people with COPD anyway tend to have an increased risk of developing severe infections, also with flu and other viruses. So interestingly, the infection rate for males and females is similar, but the mortality is not. More men die of the disease than women, and this is a well-known phenomenon because there are well-known sex differences in the immune system. Females tend to have better cellular and humoral immune responses, which means that they're better at fighting infections than men. So men are more sensitive to severe infections, and I guess everybody knows the case of men flu. If a man and a woman both get the cold, then usually the man has or pretends to have more severe disease. It's been suggested that man flu is a real thing, that men actually have more trouble fighting an infection, and this is actually suggested by these data as well. This is a graph showing the mortality of infections through the ages, and this is the male to female ratio. So with a ratio of 1, both equal numbers of men and women die of an infection, and anything over 1, more men die. And as you can see, for whatever age, except for this really weird thing at 10 years old, men or boys have a higher chance of dying of an infection. So what do we have treatment-wise? Well, there's paracetamol for fever, but there are no vaccinations yet. There's some research groups and companies are really working hard to make these vaccinations, but it will take at least a year before any will get to the market. So what people are now trying is something called convalescent immune serum. So that means serum from people who have had the disease and therefore have immunity, have antibodies against the virus, and use that to treat other people. So China has just sent, I think, 5,000 liters of convalescent immune serum to Italy to help Italy fighting the epidemic over there. Antibiotics are used to prevent the bacterial co-infection. And then there are question marks for type 1 interferons, antivirals, and chloroquine. These have all been suggested as possible treatments, but it's unclear as of now whether they actually work. And a lot of clinical trials are ongoing at the moment to see if they actually work. So what do we have for people who develop severe disease? So important is extra oxygen. This can be just a tube in your nose, or a mask, or intubation, depending on the severity of the disease. And this is important because struggling to breathe costs a lot of energy, and this energy could also be used to fight the infection. So if you don't have to struggle to breathe as much, you'll be better off fighting the infection. It has been shown for other respiratory infections that people who get supplemental oxygen do better. And if your lungs are really failing, then there is the possibility of ECMO, which is extracorporeal membrane oxygenation, where a machine takes over the function of the lungs and basically helps you with oxygenating your blood. These machines are not very common, so they're not a lot in Holland. So if there are many people that develop very severe disease, then we probably won't have enough of these machines. So if you're interested to read more, these are good websites to get more information about all sorts of things associated with SARS-CoV-2 and COVID-19. I particularly recommend the JAMA network, which is the Journal of the American Medical Association, that makes YouTube episodes with things associated with COVID-19, usually from a clinical viewpoint. So if you're interested in the clinical disease, this is really recommended. I will also upload an interview with an Italian IC doctor with the editor of JAMA about the situation in Italy, so you can watch that. And here are some people on Twitter that are really interesting to follow, that have lots of information. Some of them are from Holland, some of them from the US, some of them from Italy. They have lots of nice background information on the disease.